Almost every other day, someone comes in and said that someone new that you know has passed.
BC has recorded the second deadliest month of the toxic drug crisis, with 184 deaths in July. Outreach workers say the solutions are right in front of them, but no one is willing to help. On the downtown east side, outreach workers don't need data to confirm the rise in overdose deaths. They say they can see it every day, while many health resources are concentrated on COVID-19.
It feels like Groundhog Day. It feels like we're dealing with this month to month. It's the same thing. More overdoses. Coming to work and knowing the look on someone's face that someone that we know has died is terrible. It's hard to even know how to react anymore.
Oxygen is our second best weapon.
Lorna Bird is watching over an injection room here at the Vancouver area network of drug users. This woman says she's here because her housing doesn't allow guests in her room during the pandemic, and too many people were dying using drugs alone.
I'm here to help. Like, soon as I'm watching right away, if somebody goes down, I'm grabbing the Narcan kit. And we got our oxygen, if I can save somebody's life, I've been doing my job right.
It's depressing, it's sad. It seems like all we're doing is going uphill. There's no end in sight, it seems, and it's getting a lot of people down. I mean, I can see it everywhere.
BC's chief coroner said Wednesday the numbers are a stark reminder of the tragic and unrelenting trajectory of this public health emergency. The province released a lengthy statement which in part says it's working on saving lives in the longer term. This includes more and varied services that address the root causes of addiction, decriminalization to stop the stigma against people who use drugs, and a prescribed safer supply to separate people from poisoned street drugs. Outreach workers say they've noticed more drugs containing benzodiazepines, creating a toxic mix, and they've long called for a safe drug supply.
They would know what's in their drugs. They would know how strong their drugs are. They would know where their drugs came from.
And then they would be able to use something that's not going to kill them. And honestly, that would give us some more hope.
July's numbers bring the total deaths in BC to more than 1,200 since January. In Vancouver, Crystal Laderas, City News.